She was the brightest person in the crowd, I can tell you that. My mum was one to have a pie, have a laugh. She'd be the loudest person in the room. And everyone loved her for that.
She was the ginger bombshell.
She was.
And everybody knew her.
Former nurse Amanda Strudwick was admitted to hospital in March for cancer treatment. But despite her vulnerability, she was infected with coronavirus on the ward and died from her infection in April.
I think that's the shocking part, that the one place that you believe she's going to be the safest is the one place that she actually ends up catching it.
Yeah.
And it kind of stings a bit for the whole family, really.
ITV News has learned that thousands of COVID-19 cases were acquired in hospital among people admitted for something else while free of the virus. But could the situation have been improved if data showing how bad the problem was had been shared among different trusts sooner? Evidence first emerged in data being collected by Professor Callum Semple at the University of Liverpool.
Across England, the typical rate at the peak of the outbreak was round about 10% of people in the national cohort had acquired COVID actually in hospital.
He sits on the government's SAGE Science Advisory Committee and shared his data with them as soon as it was available. But according to these meeting minutes, the reports were classified due to their apparently sensitive nature. The government has now published a list of documents submitted to its SAGE committee, whose members include NHS England and the Department of Health. And it reveals that the data relating to hospital outbreaks of coronavirus was first discussed on the 26th of March. But we now know that information wasn't passed on to the individual trusts concerned until the 5th of May. That's a delay of more than 5 weeks. Here at Bart's Hospital in London, healthcare workers without symptoms are being tested for COVID-19. Infections are now falling fast. But tracking the spread of this deadly virus in hospitals could have been improved if more information was shared, say experts, and must be improved before further outbreaks happen.
But what we can do is learn from that, because what we mustn't allow is that to continue, because we want patients to feel safe, that they can come into hospital and get the services that they need without running the risk of being infected from COVID. And that is something that we have to get right.
In a statement, NHS England told us that any delays were due to the data on hospital infections having to be verified and checked for accuracy before being sent to trusts. COVID rates are now falling to their lowest since the outbreak began, and doctors urge anyone who needs treatment not to hesitate to go to hospital. Tom Clark, ITV News.